All right, gang, welcome back. Today we're talking about Naloxone Administration. So this is done in 3 different ways depending on the setting in which you're in. The first setting is referred to as intranasal, which we're going to talk about today, which is a nasal spray, otherwise known as Narcan. The other one is intravenous, so IV. The other one is an injection, which is intramuscular. So we have 3 different ways that we can administer naloxone. With that said, today we're focused on the intranasal. These are really simple to use. So this is a trainer, obviously. There's no naloxone going to be administered in using this little spray. You can see there. This is a real naloxone, right? So this is a real nasal spray that we have, otherwise known as Narcan. So when we have opioid overdose is when we would use this, of course. So if we suspect opioid overdose, we have access to this because it's in our AED kit. That's when we want to administer it. So the nasal spray is relatively straightforward. You peel the package off the back, take the spray out. We 2 fingers across the top, hold at the bottom. We go up the nostril until your fingers are touching the bottom of your nose, and from there, we spray. Okay, so this is a 4 milligram dose of naloxone, or otherwise again known as Narcan, that we would administer to a person experiencing an opioid overdose. You should probably take a course on the administration of naloxone. I know you can do this as a skill boost with the American Red Cross. It is a part of the standard program, and you do learn about this in the online course, but the administration certificate of it is separate. It is an add-on for your courses. So again, I would highly recommend you take that course if you're in a high-risk type of job or maybe workplace or maybe setting that you're constantly around, to make sure that we can help respond when we recognize opioid overdose, to help reverse the effects of opioids, especially that they have on the brain. So we'll again use the intranasal for naloxone, otherwise known as Narcan. Thanks so much for joining us today. Hopefully you guys enjoyed the video. Have a good one.